So I said, what I'm going to present today was originally material that I developed when I was working for Inspire in Scotland, and it's round about navigating public sector commissioning, kind of mainly across health, social care councils, because that's where I've worked. I've also worked in Scottish Water as well, but shall I say the funding situation's very much different there. And this is a lot of information. And the first thing I've got to restart, anytime we restart, something to remind me to say to you is that if you work for a national organisation that covers all of Scotland, then this is going to be much harder for you to implement bits, because there is not one body that you go through because of the makeup of organisations. So this may be harder. And what I'd say is you might want to be a bit strategic about what areas you go for. But we can talk about that at the end. So the background is this is just really the infrastructure set up in Scotland, kind of. So we've got 14 what we call regional health boards and 8 special boards. Now, I had this picture and I've been using this picture, but I just had to update it because one of them is now defunct and it's been replaced by Public Health Scotland, which was a combination of 3 different functions, but they're the 8 special boards. So when you hear people talking about NHS, kind of it's handy to think about what type of NHS are we talking about. There's 32 elected councils kind of across Scotland, and in terms of integration, which is where kind of NHS, health and social care, wellbeing services come together, there's 31 health and social care partnerships, now, there's 31 health and social care partnerships because Stirling and Clacks combined, so they've got an integrated kind of joint board, and also NHS Highland, they don't have a health and social care partnership as such. Their NHS has taken the lead as a lead agency. But what you'll hear with health and social care partnerships is the term integrated joint boards and health and social care partnerships. Now, this took me ages to get my head around. So integrated joint boards are a part NHS board and part local authority that come together, and they can choose to have an integrated joint board. Highland doesn't. But what they do in that integrated joint board is they develop a plan, a strategic plan for how they're going to deliver all the services kind of underneath them. Now, that's the legal bit. The integrated joint board's the legal bit of it. Health and social care partnerships are actually not legal, and what you'll see, legal entities as such. They are combined. They're made up of NHS employees and council employees. That's why you'll never see an email address with a health and social care partnership in it, because employees belong to either one or the other, what I would call like kind of mum and dad organisations. Now, each of the health and social care partnerships are always, so they're all responsible for adult social care, adult primary health care, unscheduled hospital care, but then some are responsible for children's services, some aren't. Some are responsible for homelessness, criminal justice, some aren't. So it's really about understanding the ones that are local to the area that you work in, what services fall underneath the remit of the integrated joint board and the health and social care partnership as the unit that delivers their plan in those areas. And I said that there's 31 health and social care partnerships, and I think there's probably 31 different ways of services, of makeup of services underneath them. But you can find out a lot more on this website. It's not umbrella, or it's an umbrella organisation, but not kind of everybody. It's not got a regulatory or governance. It's just more of a helping people understand health and social care partnerships and integrated care in Scotland. Now, how are health boards, local authorities and health and social care partnerships funded? Now, this becomes kind of really important when kind of you think about the delays and some things. So we have the local authorities, and this is what they were funded last year, a total 23.5 billion, so it's not an insignificant amount. 9 billion of that was from the Scottish Government grant. So that's quite a lot that comes into local authorities on an annual basis. Then you have NHS boards, which are funded according to a formula you could find out more about on Public Health Scotland, but that's about 14 billion. So if you think about, I like describing them as mum and dads, and then they have a child, which are integrated joint boards. So funding, integrated joint boards don't get any direct funding from the Scottish Government. They get delegated funding from local authorities and the NHS boards. Now, if you can imagine, local authorities and NHS boards sort out their own budgets and planning, and there's a bit of backwards and forwards between the IGBs and themselves, kind of saying, but hold on, last year you gave us this, you need to give us more. So it always takes longer for the IGBs to sort out the budgets just because of how the cash flows kind of down from them. Now, we have these things, and I'll come back to this later, that are called additional allocation. So that's money that the Scottish Government mostly will give boards and local authorities kind of through the year. But again, that comes down, it's not directly given to integrated joint boards, which the legal bit, Health and Social Care Partnership, the delivery bit of the plan of the integrated joint boards. So they come in kind of various points during the year, but they will be passed down through the mum and dad organisations. I like describing it sometimes as the mum and dad are not really talking that often to each other, and they're disagreeing about who's paying for the kids' extracurricular activities and various bits and pieces, and that's what IGBs suffer from, I think. Now, this is just a special mention because although this is technically not public sector funding, what we've seen in the last couple of years is TSI getting substantial amount of money through the Community Mental Health and Wellbeing Fund. This year it was £15 million, but they were dropped another additional 15 million on top of that, so bringing together the total for this year to 30 million nationally. Now, TSIs are, again, don't have a governance body or an umbrella membership body. They have the TSI network, but again, it's not for governance. So there's not what that means is how community mental health and wellbeing funds are distributed are different in each of the 32 TSI areas. Now, the reason why I flag this is although that this money is distributed by TSIs and managed by TSIs, health and social care partnerships are actually named in the Scottish Government letter that goes alongside to be partner decision makers and partners in the management of this fund and the distribution of it as well. So that's always really kind of interesting to know and kind of keeping it at the back of your head. Health and social care partners, now some of them will step back and let the TSI get on with it. Some of them don't, and they're kind of very much involved there. But just to say that although it doesn't seem that public sector are involved in the distribution of that, they should be. So this brings me on to the question, and at this stage I always like to say kind of, do you think you're part of the health and social care system? I come across an awful lot of community and third sector organisations who are like, well, no, because we don't really do health stuff or we don't do care stuff. But what I would say is you absolutely are, because if you're involved in support health and wellbeing of people, then you're part of the health and social care system. And this becomes really important when it comes to understanding what funding may be available from public sector bodies, because it's not always obvious from the title of funding about kind of what it's actually intended for or who can go for it. So what I would say is, if you don't consider yourself part of health and social care, kind of have a real look at it again in a slightly different light, because I think you'll find that you are. Always to highlight as well is that the public sector system is very siloed, and this includes for not just the delivery of services, but for distribution of funding as well. So what may go to one team to distribute, but it's because it suits the public sector. It's not to say because if it goes to, for example, the head of service for learning and disability, that it's only for organisations that are kind of identified as learning and disability. It could just be that that's the most appropriate place to distribute the funding. So back to that great redrawing of local authorities and NHS boards about how the money kind of trickles down, I want to cover the examples of additional allocations because they are quite substantial. So every year there's money for winter pressures, winter plan money. Now, again, you might think, wait, oh, that's just for hospitals. It's to get people out of hospital. And actually it probably was, but 3-4 years ago, what we've seen is we've seen a big change in that money when it trickles down through local authorities or NHS boards, is that they will they have been, how do you say, they're much more willing to use that money to allow people to stay well and stay at home. So actually avoiding admission to hospital, rather than just delayed discharges and getting people out of hospital. So yet again, don't rule out winter pressure monies when you see it happens every year. What we saw last year though is there was probably less money in winter plan money. I think the Scottish government were saying we're putting X amount into winter pressure, but actually when you look at what's the additional monies, there wasn't actually that much additional. They were just telling local authorities and NHS boards how to spend some of their money, which is probably not helpful for local authorities or NHS boards if it's not actually any new money. The other big one is whole family wellbeing support. So that's 500 million over 4 years. So that's not an insignificant amount of money. And that goes straight into children's service plan and partnerships. Now, I know I did this nice wee diagram that makes it look so simple, but there's a couple of things that kind of, how do you say it, are a nice kind of mix up of all of this. And I'll come to that in the next one as well. We also have alcohol and drug partnerships, which is approximately 113 million last year, and additional money that goes directly to ADPs. Now, ADPs, and I'm not as familiar with children's service plan and partnerships, but it's the same sort of thing as what it is organisations working collaboratively. So I'm much more familiar with alcohol and drug partnerships. They would have representation from Police Scotland, criminal justice, NHS, local authority, health and social care partnership, all sitting on kind of ADP board. I imagine children's service plan and partnerships are very similar. When I did a bit of research to see what they look like, is again, it's one of these things that they're all called different names, but what you're looking for is about what is the partnership that it governs that money or kind of makes decisions about that money. So when you come to do a bit of investigation, that's the sort of things you're looking at. But I just wanted to bring these in here because these are big pots of money kind of, and they should be spending a good proportion of that in community and third sector organisations to provide additional support in communities. Now, there's other additional allocations that come in during the year, but what I'd say is you do have to kind of put your Miss Marple hat on to find this out. The first thing I'd say is when you see anything released, kind of find out about the detail, go to Scottish Government website. Scottish Government are always very good when they release money and put additional allocations in, kind of it's on their website, and an awful lot of the small print is there as well. If you click on it, it's the link here, the Children's Services and Planning Partnerships. It very helpfully tells you how much each local authority got. Also alcohol and drug partnership, if you go to the Scottish Government website, it gives you name of all the strategic leads for every health and social care partnership area, but also the breakdown of how much money they get a year. So do kind of go and find out, and what you'll find as well on Scottish Government website or anywhere is that you'll find the purpose and the intended outcomes of the fund. Now that's where that sometimes you realise that actually this is maybe money that you could go for kind of, or it would be applicable to the work that you do. Then what I'd say is go and find your local strategic leads. So there'll be a lead for the Children's Service Plan and Partnership. Somebody's always got kind of leads job of something. Strategic leads are all helpfully there on the Scottish Government website. Also as well, I'd get looking for your anybody involved in strategic commissioning and kind of your health and social care partnership, your local authority, because within their strategic commissioning plan, there should be the lead for the Children's Service Plan and Partnerships and the ADPs and any other monies kind of that have to be managed that way. Also read any evaluation or annual reports of the fund if it's local or nationally. I know that there is a evaluation of the whole family wellbeing support. It was done last year, the year before last. Read that to see what happened, what the problems are, what was good, what was bad, because it helps kind of give you a bit of information and understanding about that might make your case and kind of help you formulate a plan or some action. Also as well, I always advise that I do this as well, kind of read any health and social care partnerships, strategies, annual reports, local authorities too. Also IGB board papers, they have to be made public. So you will find it might take a wee bit of search because some health and social care partnerships hide them kind of quite well. Their websites aren't necessarily the best, but the board papers are there and available, and it shows you decisions and shows you the decisions that are made about funding, and just helps to kind of add to the information kind of when you're investigating kind of more about these funds. Now, before I come on to commissioning, I wanted to just talk a wee bit about policy landscape in Scotland. The policy landscape has been changing ever since Christie. And I'd say as Scotland have got some fantastic policies around commissioning and working with community and third sector organisations. It's implementation that hasn't kept up. And what I say to everybody is we don't need more policies. We need more support for those policies to be implemented, because if those policies were implemented, it would be really, really good, because the policies are really, really good. There was something released just last week that I think is worth a wee read. It's from cross-party think tank, and I think it's Demos, and it's really worth a read. It's not a new vision, it's an old vision, and it's a vision I think everybody here would agree with about shifting power from public services into community and third sector. Kind of how do we work together? How do we move the money? How do we move to prevention? Kind of, it's not a huge document, and it maybe take you 15 minutes to read, but I think it's really well worth thing. An awful lot of Scottish policy is already there, and this is probably just adding to a bit of that. But it's a really interesting reading. It's interesting that that's where kind of as a UK we seem to be pointing to. Policies, what we've seen is shifting and balancing of care from acute to preventative. Again, there's lots of policies on that, but it's implementation of how do you do that, because the reality is you're going to have to move money from acute to prevention and early intervention and prevention services or support, and that's hard to do, is take money off of somebody who's had money for decades. But what we know about prevention and early intervention is it's cheaper. So Mark Smith is work originally in Gateshead, but now across Northumbria, Changing Futures Northumbria, his Liberated Method. It's fantastic work. I know Mark and been alongside him kind of in these case studies and finding out about it. But what he's now getting to the stage of is not only do you do the right thing, giving people help when they need it, what that does is it reduces the demand for specialist services. It then saves money as a consequence, and it makes people's lives better. And what they've now done is they've done a lot of work around the data, and the data is kind of quite stark in terms of if you give people the right thing when they need it early on, how much it saves the public sector. Although some people flip it about and do it for the cost savings rather than the doing the right thing. But it's that, again, all Mark's work is really worth a read. Just to say, he even talks about getting rid of eligibility criteria and how we have to stop doing assessments. Well, certainly as many assessments. What's in policy is there's a big move to keep people well at home for longer. We've got an ageing population and people want to spend longer at home. How do we facilitate that kind of in terms of commissioning? Also, people want more health and wellbeing support closer to home. This is obviously a big issue in rural areas as well. So how do we commission services, or how do we commission support that allows that to happen? So we've had the Feely report, and I'll come on. Oh, it's just below this actually. Kind of an awful lot of people write Feely off as just it was a review about adult social services. It's really relevant kind of to all the sector, and it's really relevant as we move towards a national care service, whatever that may look like. Because Feely, this is taken directly from Feely about kind of old thinking, and in terms of even mentions commissioning here about we should be less about competition markets, more about collaborations, kind of less about transactions, more about relationships, kind of. So the Feely report, what I'd say is working in the public sector, it was really, really well received. And I think you'd be hard pushed to find anybody in the public sector that disagrees with much that's in Feely. Again, it's not about kind of what it says, it's about how does this get implemented. Again, if you've not read it, what I'd say is it's worth a bit of time to read. Now, we move on to what actually is commissioning. Which is probably what you thought you were here for anyway. It's not procurement, and an awful lot of people get this mixed up, kind of, and I'll come to explain the difference is that commissioning is the planning and identifying the needs. So that's really, it's the what is it we need for normally a cohort of people or a section of our communities. Kind of commissioning is how you plan and identify that need. Procurement is a process of buying what's been identified. It's how do we get what we need. It shouldn't be a dark art, but it is a dark art. There's a lot of language used on purpose, I think, to put people off. But it's completely okay to ask questions and ask people, well, what do you mean by that? NHS England's got a definition of commissioning that I really like. It's about a continual process of planning, agreeing and monitoring. Now I've put highlighted services there because I don't think it has to be services, and I'll come on to that. So commissioning is not one action, it's lots of actions that may happen in a kind of sequential way, but often it's not, can be a bit messy. But it goes for everything from health needs assessment through design of patient pathways. I don't particularly like that term because pathways are standardized and it's sometimes not about standardization, but it goes right through to kind of what you contract, how you contract that through procurement, and then how do you do the kind of the monitoring and the quality assessment. I put the Google definition in as well, just to highlight is that the Google definition is to order or authorize the production of something. And they use the example of a portrait being commissioned by a widow kind of way back in the 1700s. If you think about commissioning in terms of art, kind of commissioning, if you commission a portrait, you work with the artist. So collaboration is actually built into that definition kind of commissioning. So it's kind of quite interesting that we've been away, we've kind of separated ourselves so long, and commissioning was seen as a very transactional process where actually it has its origins in collaboration. So I would say as commissioning happens when money is moved from one party to another for something. And at this point here, I just want to highlight is that people talk about grant funding. I believe grant funding is a form of commissioning. So yet again, commissioning is an umbrella term kind of for what happens, a model of what happens when you move money from one party to another. Now, we're going to the commissioning cycle. And again, I've used it from Feely because I really like the colours, and I think it's one of the easier versions of this to read. So here in Feely, there's a whole chapter out which I think is really readable on commissioning, and I think it's chapter 21. And I'd really encourage you to read it because it gives you hope that somebody has a plan for what it should look like. But the majority of public sector commissioning is based on this traditional model that was first published by the Institute of Public Care back in 2018, kind of, and is very, I would say, transactional. So if you see the outer layer here in the pink, is the commissioning cycle, and the procurement and contracting is inside. Now it makes it look like it goes hand in hand. It kind of doesn't. It's more of a, I would say it's more of a spiral kind of than a circle. But if you start, very rarely do we start from just planning with nothing having been there before. So actually I would always say the start of the cycle is kind of analysing what you have at the moment and going through your population needs and looking at legislation and anything that's changed. That's normally the catalyst, or it's a place to start before the planning. And then there's the gap analysis. Now the commissioning strategy is really useful. Every local authority should have one, and they're likely to have one. Health and social care partnerships may have their own. But also it's a good point just to say is that because health and social care partnerships are made up of NHS and local authority, the commissioner tends to be whoever is the head of service. They tend to rely on, in my experience, local authority to do a lot of the procurement because they have lots more, I think, experience in contracting for care and support services than NHS. NHS are, in terms of their commissioning, tends to be around about buildings, capital, and widgets and digits. So you will actually see most of the procurement done health and social care partnership is by somebody with an email address that is a local authority. So have a look out for commissioning strategies because they're very helpful getting if you understanding kind of what your local authority health and social care partnership, how they operate in terms of commissioning. They're right through to the doing and the reviewing. What I'd say is that I'll put this bit in first. The traditional models doesn't take it in the new direction of what I would consider to be community-informed, collaborative and ethical commissioning principles set out in government policy. And I'll come on to that in a wee minute. But what I was going to say is that it's absolutely appropriate to ask where your local public sector service that you're trying to establish a relationship and understanding of is where they are in the commissioning cycle. That's a completely legitimate thing to ask. Even if they're midway of the doing phase of this, kind of what I'd say is don't let that put you off. Because by feeding in information about learning and data about the communities and people that you support, you can highlight gaps in service or issues arising about what's not working or various things there. So what I'd say is even in the middle of essentially a commissioning cycle, a 3 or 5 year commissioning cycle, is it still worthwhile kind of getting involved in establishing that relationship. Now, this bit is about types of commissioning, and I'll say straight off the bat, the best resource bar none is CCPS's resources around collaborative commissioning. You don't need to be a member to access, and although they're written with social care and care at home and with that sort of thing in mind, they're absolutely applicable for everyone. I don't think that, I think that program's been curtailed in terms of developing resources around kind of commissioning, which is a really great shame because the resources have been absolutely amazing. So I've got a link there to some, but the ones I'd really point out to is a possibilities document that shows you alternatives to traditional commissioning, which I would say traditional competitive commissioning. And what we start here to highlight to remember is that CCPS have 4 questions they ask in any new model of commissioning is, does it shift power? Does it increase choice and control? Does it, I've made a note of them so I don't forget them. Does it increase accountability and transparency about commissioning? And does it increase sustainability? And I think those are 4 great questions to ask any commissioner. Kind of, how does your commissioning process do these 4 things? But specifically in the possibilities document, oh, I've got an itchy nose, I'm going to be angry. They talk about outcomes-based contracting, which I think is a step forward. My opinion is outcomes are generally not well written, but I think it's a step forward rather than being really fixed. This is a service that we need and it's inflexible and it's a competitive tender. Public social partnerships. There was pilots in that in the oh, I don't know how many years ago now, 6, 7, 8 years ago, there was pilots, 8 pilots across Scotland. I still think these are a really, really good way of trying out new models of commissioning. And I know that Edinburgh is doing, I'll come on to what Edinburgh is doing, but yet again, with all these models, it's about who writes them. And I think if it's somebody who's experienced in setting up public social partnerships, they're really great and flexible. You can extend the length of time, you can drop more money into them, all of that. Alliance contracts. Now, I'd advise you to read about this because I think it's a way forward. An example I'll talk about, make reference to is Plymouth have done this really well, and it may not be what you think it is. An alliance contract is where public sector says, we have 8 million to invest each year for the next 4 years. We want to set up an alliance contract with an alliance with a group of community and third sector organisations. And once they set up that contract, the public sector organisation sits in that alliance as a vote at the table. They don't control it, they're part of it. The alliance makes a decision about how that money's spent. Now, we've seen some alliance contracts set up in Scotland that have failed, but yet again, it's because they were maybe not written properly and everybody involved wasn't supported through how to do that because it's such a big shift in power and it's a really different way of working. Participatory budgeting is one. Say I would always be a bit cautious. It tends to be used for grant making, not that much money. Also, as well, it really skewed against areas that the public or people may not vote for, like alcohol, drugs, kind of minorities, kind of things that people maybe not be kind of as charitable about, kind of, and want to put their vote to. So again, participatory budgeting always comes with a, is it appropriate for what what we're trying to commission? Community commissioning, it covers quite a lot of things. I'll talk about Edinburgh, what Edinburgh's doing in that, which is really exciting, but we don't tend to see it done on that kind of big community basis. Direct awards. Now, direct awards, people are like, oh, the public sector can't make direct awards. Public sector can make direct awards of up to £600,000. What they have to do is show the market reasons why this one organisation is the only one, and there may be reasons, kind of emergency reasons why it is, but direct awards can be made, and I'll come on to a bit myth busting and grant funding. Now, grant funding can be completely changed and done in different ways, innovative ways. It depends who's setting up the grant funding. I'll talk about one that I've been involved in that's really, I think, innovative. Also, please have a read of this, The Mythbuster for Procurement of Social Care. It does about the direct award. It covers other things as well. It's literally 3 pages. It'll take 5 minutes of your time, but it'll make you feel better and actually maybe answer some misconceptions you may have about what procurement in public sector can and can't do. Actually, I know this has been recorded, but maybe some commissioners in procurement and public sector should read that as well, because it does shock you, some of the stuff in it. So who's doing it differently? Now, I'd point people to this. New Local is think tank, a national organisation. They're actually having a conference this week, but the new chair is Katie Kelly, who is Deputy CEO East Ayrshire and had vibrant communities, and it works together to really put power in communities' hands. So they've got lots of examples of kind of commissioning differently. The two that I always point people to is Plymouth. Plymouth is the best example, bar none, of alliance contacting around complex needs like alcohol, drugs, substance use, domestic violence, criminal justice, homelessness, all the really difficult stuff. They created an alliance contract, and it's now been up and running for years now, and it has evolved, and they've now rolled it out. I think that way of working and commissioning, they're rolling it out through the whole of Plymouth now. It's led by Gary Wallace. So anytime you get a chance to hear Gary talking about what they've done, listen, he's really great to listen to. Very dry sense of humour as well. Liverpool Regional Authority, they were looking to commission outreach homeless services, you could call it, but actually they didn't commission a service. They commissioned a learning partnership with a collection of community and third sector organisations. So again, it shows I don't believe that you commission services, because I think by commissioning a service, a public sector has to state what they're looking for. But actually, you don't have to do that. You can be flexible and say we want to commission learning partners who will help support this cohort of people in any way that's best to do so. So those two are really good examples, and it falls underneath kind of human learning systems. In Scotland, East Ayrshire have done a market facilitation. That's how they interact and engage with community and third sector organisations around providing additional support in their area. A while ago, helped them set up the kind of wellbeing funds. It was participatory budgeting, but kind of has a bit of flexibility in it. East Ayrshire Council looking at how they commission differently within community-led regeneration. Edinburgh in particular, Thrive, which is their mental health and wellbeing programme, has won awards for that commission process model. Sorry, it's a PSP. And it's a contract that runs for 5 + 3 years. And I know most of you would kind of give anything to have 8 years funding from a health and social care partnership, but they're making great headway in that. Capacity to Collaborate was a fund I helped Edinburgh Health and Social Care Partnership set up, and it was a £250,000 a year fund that was set up to fund the activity of collaboration, not the outcome or not the output. So it recognised that if you're going to collaborate with other community third sectors or public sector, that as a community or third sector organisation, is that costs money. So they invited applications from people who wanted to collaborate and just say, tell us a bit about what you want to do, and they were funded on that basis, which I think is quite exciting. I've not seen it anywhere else in Scotland. They're also working on a community commissioner model at the moment. So the Health and Social Care Partnership, their kind of strategies around to help citizens of Edinburgh have more good days. So they've called their model the More Good Days Public Social Partnership. And what they're doing is they're looking at a different way of funding. They're looking at how do they pull together all different pots of funding underneath a PSP, kind of, and it look to commission it for kind of a longer period of time, kind of for early intervention and prevention. Also, I just put in here as well, NHS Highland are doing a lot of work around SDS within Control Scotland, looking about what could better help communities. So I know that they've just put out a report about some of that early work, about working together. And they're about to experiment with how they do it different in rural communities, and kind of then following up with SDS, how SDS can support that. And what I'd say is SDS is a form of commissioning because they're different options. It's about kind of how you work out what you need. So I'd look at that as well as a good example in Scotland. Now, I made passing reference to Scottish Government's ethical commissioning principles, but I think it's really important to talk about this because this is coming. And I know that the National Care Service may have faltered a bit, but in every bit of legislation or every iteration of what we've seen coming out of the National Care Service is ethical commissioning principles are there. They're not going anywhere. If anything, they're just going to be getting more detailed. And I've put there, I know that many of you wouldn't even know that this exists, that there's a special policy notice that kind of details this out, but actually it's a direction of where we're going with collaborative, community informed and ethical commissioning principles. I just want to say is I use community informed on purpose. I think that there's some cases where commissioning shouldn't be community led, it should be community informed. Maybe a discussion for another day. But the ethical commission principles set out by the Scottish Government, people say ethical commissioning just like it's a thing, but actually there's 8 principles. The Scottish Government put in saying that ethical commission should be about any support or any commission should ensure that it's person-centred care first and foremost. There should be a human rights approach woven through it. There should be full involvement of people with lived experience. That any commissioning should have fair work practices. It should have high quality care. It should be cognizant of a climate and circular economy. I think that'll be separated out in future. That any commissioning should have financial transparency and commercial viability. So this is not about race to the bottom, and that commissioning should take care of sustainability within organisations. And also this one, which I think is going to be really difficult for public sector organisations to get their head around, is around about shared accountability. What we tend to see in any commissioning and then procurement that follows up, kind of that goes out to secure that, is that the risk is passed to the other organisation. And what Scottish Government are saying is no, there has to be shared accountability. This is not about passing risk on. This is about us sharing it. Now, what I'd say is it's completely reasonable in any public sector commissioner or procurement process asking them how what they're doing reflects the Scottish Government ethical commissioning principles. Now, I imagine you'll be met with a blank look sometimes, kind of, but actually it's completely legitimate to ask because these things are not something that anybody would have an argument against that they didn't want to do. Kind of, so even if they are not aware of them, kind of each health and social care partnership, local authority, NHS should be working to these anyway. So I've spoke a bit about kind of commissioning in public sector and all kind of the different types and the models and all that, but actually who are the commissioners and the decision makers? Where does this responsibility? So what I'd say is the work that you do, have a think about the area you support and have a think about who in the organisation or who in public sector may have a responsibility or part of a responsibility. This could be in more than one area, kind of in more than one organisation and more than one person. My community group that I set up was about helping parents, families support the emotional health and well-being of the children. Some people saw that as being mental health. Some people say it being child services. Some people say it's in adult education. So it's about thinking about what organisation and being aware of them, because what they will do is they may ping you about pillar to post saying it's not us, it's them, but you have to kind of play the game and get them all together, and saying, well, who is responsible? I said it could be in any of them, but it also could be in one of the strategy groups that sit across an area, which makes it even more confusing, because in a way it's everybody's responsibility, but in terms of governance, the responsibility for that service area, as they like calling it, would lie within that strategic group. It tends to be heads of services, I would say, that hold budgets. The service managers might do, they might be delegated. Very rarely would they trump a head of service. I'd put this in here from Inspiring Scotland because I fund manage an Autism Portfolio. So they tend to put autism in with learning disability. There may be people responsible for neurodevelopment pathways. As I said, children and families is an interesting one, because actually that sometimes sits within the council as children and families underneath education, but in other areas may sit within Health and Social Care Partnership. Also look out for directors of strategy and planning. Although they may not be budget holders, they can be quite influential. So knowing who they are. Also locality managers as well within Health and Social Care Partnerships are really interesting to know, because they do hold budgets. Ask them how they currently invest in community and third sector organisations. Like, do they have a market facilitation statement or a charter? Do they have a strategic commissioning plan? That gives you an idea of how, in theory, they plan to operate. Now, it could be that you hold a strategic commissioning plan, and I've seen some really good, well-written ones. However, when you speak to heads of service, they don't work that way. So you may have to do a bit of kind of bringing them together and going, but hold on, you're saying this, but you're not doing that. There's always, I think, a bit of gap around the narrative of what they want to do and the reality of what they do. And sometimes you may have to be that annoying person in the middle, kind of getting them to kind of align a bit better. Ask about where they are in a commissioning cycle and how you can feed into any needs assessments or a gap analysis. And if they're doing any work in redesigning service areas, ask how you feed into that, because getting in, you have information that they would want, so you have something of value, but also you get something who really influences what they're looking at and the people that they serve. So why wouldn't they want that information? Also ask specifically about integrated joint board grants and who the commissioner with the responsibility for these are. Each integrated joint board or health and social care partnership works in a different way. They may not have a central IGB grants, but they may do. Some of them do. I know that they do. So just trying to uncover where they lie and who's responsible. Now, community planning is really interesting, and what I'll say in my experience is nobody has ever got any notable or long-term funding through a community planning process. However, what I'd say is I think there's a intention to move to community planning being a much more integral part of commissioning processes, but I don't think it's there yet. What I'd say, it's a process to be involved in, and go along and seeing what's happening and feeding in that way. Also ask TSIs how they work with the public sector partners. Um, um, and in particular, I have a bee in my bonnet about some TSIs work with health and social care partnerships around funding, a joint funding thing, but it's largely public sector money. But the money is that small. So there's one that appeared I saw recently, where it's called it's Community Solutions in an area, and it talks about how the local health and social care partnership wants to fund community solutions to problems, and and then invite applications, and made it sound and the TSI was supporting this. Turns out it was for a total of £60,000. And they wanted to fund 10 organisations. That's not a lot of money. And I imagine that the application process is disproportionate to the amount you get as well. So always ask TSIs, but also TSIs are there to support community and third sector organisations. So encouraging them to stand up for you is and with health and social care partnerships, especially around funding like that. So general tips. as I said, find the decision makers for your type of service or your area. It might not be obvious, might be more than one person, might be more than one organisation. And this is where if you're a national organisation, it's definitely going to be more than one organisation. Also have a look on website, annual reports, IGB documents, press releases. Now, the one thing I'd say here is finding the person will not be obvious. Public sector are really bad at putting people's names out there with their job titles and actually what should they do and what they're responsible for. So it may not be obvious, and don't think it's just you can't find them. Is that if even the emails that I get sometimes, and it's not got somebody's job title or what they do on it. So you do really have to do a lot of digging in some cases. What I'd say is that generally what I'd call the come apply for me funds, which are the grant funding, won't be for any more than £10,000 and won't be for any more than a few years. So the question is where you want to put your efforts into securing that. What I would say is it's really useful if you don't have a relationship with public sector organisation and commissioners. This is a good way of getting them to get to know you and get in there and start kind of pushing them information and having conversations with them. When you find out who the commissioner or decision maker is around something, and I put a wee asterisk here, it's very rarely procurement. Procurement don't make decisions about what is being commissioned. It is the commissioner, head of service, whoever that is. Start a conversation with a view to building a relationship, seeking clarity about commissioning process, about how they're currently commissioned, and push for transparency of decision making. Ask questions, because if you don't ask questions, then nobody will know, and it then becomes a dark art. But also feed in useful intelligence about how to support people. So the work that you do, kind of supporting people at that face-to-face kind of level, working with people, that's gold dust, and that's what information should be given to commissioners, because that's what they want to do, is to serve communities. More general tips. Please remember all grant and procurement tender criteria can be questioned. It should be proportionate and not put small local grassroots organisations at a disadvantage. What I'd say is recently, when I was in Inspiring Scotland, there was a question that came up with one of the organisations who had been invited to go for a tender, but they were asking the tender process, which tends to be standard, was asking for quality management policy, and they don't. They're a small organisation, so I was like, no, question it, ask them it to be proportionate. Why do they need it? Also, because of your governance, you would need your board to sign off. They only meet once every 3 months, so they can't do that. And actually, by challenging it, they come back and said, actually, you don't need it. That's fine. Also, any outcomes and outputs can also be queried. An awful lot of what we see in grant applications is, oh, we want to do this to make people's lives better. But actually, if you've got a different way of doing it, kind of don't be afraid to suggest something else that achieves the same outcome, but by a different route. Grant and tender criteria are not the law. They're not legislation. And I'd even argue that legislation and law can be changed. They are something that's been made up by commissioners, for the want of a better word, being lovingly crafted, because it gets them what they think that they need. So you can always have a conversation about it. How public sector invests with communities doesn't have to be done through a competitive tender with price. The priority. Now, people say competitive tender like it is about price. I would say if you're looking at, I would say public sector can do competitive tender if that's what they want to do, but do the competition on who's best placed to provide the support for the people, the cohort of people you want to support. Again, possibilities document is a great resource. Read up on it, but don't be afraid to question why they've done it one way and do it another way. Also, this bit here is they don't have to buy services, and for any public sector commissioner, I'd say is moving away from services, because if you say this is a service I want and you outline it, you're being really inflexible about what organisations like yourself can do, and it's the whole thing about is how you adapt and learn and change to the needs of the people that you're serving. So the way forward, I think, is it's about not funding services. It'll be about funding partnerships or funding the support of a cohort of people. Start to reference any relevant policies, especially Scottish Government ethical commission principles. I think that may come as news to some commissioners, and reference other areas who might be doing it differently, because there's a bit of competition, but also it's kind of good practice, kind of saying, oh, this area is doing it this way, this is what they found out. Don't assume that commissioners and procurement know everything else that's happening everywhere else. I've got even more practical tips for you here. Find yourself an ally or a group of allies. If it's in a geographic location across different services, or if it's the same thematic area spread across the country, because when it comes to developing some relationships with some public sector organisations, it can be really lonely because you're met with being shut down every step of the way, because they can be really defensive about what happens, and it can take loads of energies to keep trying to push the doors open, kick the doors open sometimes. So actually find yourself a kind of a group of allies that can build that support. Don't assume public sector, including commissioners, know how your organisation is structured or funded. Please don't. Is even as much as last year in an NHS organisation, I saw commissioners thinking that voluntary organisations meant the same thing as volunteer-run organisations. So please don't assume that public sector know how your organisation is structured and funded, and find some way of letting them know. Also, I'd really encourage you all to be transparent and open and repetitive about how much you get from where, by clearly stating public sector organisations in an area is they invest zero in you, and about you support X number of people from this area, and the investment from the Health and Social Care Partnership or any other public sector organisation is zero. Be specific about the additional investment you bring into communities from philanthropy, I can't even say that. You know what I mean? Funders and national funders, national foundations, because what you're really saying is by investing in us, we also bring in additional money for additional support to the people, the benefits of people in our communities, and really benefits you as a strategy organisation. So kind of make it kind of, this is how much you kind of lose if you don't invest in us or we don't exist. And also, I'd be put that front and centre of everything, especially when public sector's and I've worked with, in Spine Scotland, I had one of my third sector organisations did all support for a huge cohort of people in a health and social care partnership area, and was the service that that the public sector referred everybody to, but yet invested zero in that organisation. Kind of, so being that, but that up front, kind of front and center of everything, kind of being very clear, can maybe cause embarrassment, or can maybe kind of make people rethink, well, actually, if we're referring everybody but not investing in that, there's something not right about that. Try to build a relationship, kind of, even if the chances of getting investment and recurring funding from them is small at the beginning, because the first thing that they will say to you is that we don't have any money. And my answer to any commissioner or anybody is that you do have money. You've lots of money. The issue is not about having lots of money. It's about how you choose to spend that money. Kind of, so you will be met with, we don't have any money, and shut down, but actually start capturing the learning from how you support people, share the learning with them openly, kind of, and from a perspective of how do we work together to help people in communities, kind of, but also capture the learning about trying to build relationships with public sector. This is not readily available, kind of, and only exists anecdotally. What we see, I saw it in Spine in Scotland, Scottish Government's beginning to attach conditions to funding, saying that organisations have to work with community and third sector organisations will have to work with public sector organisations. And that's kind of pushing the onus onto yourselves to make that relationship work. But if you keep on trying and you're doing things that's not working, you need to go back and say, this is what we did, and this is what happens as a result of that. So it then doesn't become anecdotal, it becomes evidence. And I think that evidence is what's really needed, because we need to move to working together. And I get that some public sector organisations are scared to do that, kind of, but there needs to be an incentive for them to do that. Now, some are really good, some are really not so good, and there's probably restorative work that has to happen before you have a relationship, but keep a note of what you do and share that learning. And I think this is my last tip, is set aside time as a team or an organisation to strategically plan your engagement approach and activities. If you're a national organisation, you may want to choose who you go for, kind of who you're targeting, what fund you're targeting in particular, kind of what service area, what people, how you're going to do it, who's going to do what. I think taking time to set aside to do that will, as I said before, it takes lots of energy. So thinking about how you're going to use that energy, that you've only got so much to use. So where are you going to aim it at and how are you going to do it? And also it sets the tone, because there's some areas, and I have no doubt some areas that you'll work where health and social care partnerships, local authority, NHS kind of don't want to engage with you. So it will take a lot of your time, and you may want to go in a bit more full on than you would in other areas. So I'd say setting aside a bit of time as a team, like not months, kind of like a bit of time to think about it and plan what you're going to do could reap loads of benefits. And there are just some links I've put in the end. IRIS have this ethical commissioning course in social care. Again, what I'd say is, if you want to build your knowledge and skills and feel your confidence around dealing with public sector organisations, do that course. It is brilliant. Also, there's podcasts that CCPS have done as well around about commission and procurement differently. Again, you may think that it is just about social care. Kind of, it's not. It applies to everything. Really worth a look. And then I put in some Changing Futures Northumbria just because they're really good to read and it's really inspirational. And that is me finished.